Here's exactly what you're going to pay for Medicare in 2026. Let's start with Medicare Part A, also known as your hospital insurance. For those individuals who have worked either 10 years or 40 quarters, there's going to be no premium attached to Medicare Part A. For Medicare Part B, also known as your hospital insurance, most people are going to pay 202.90 in 2026. For Part C, also known as Medicare Advantage, those plans are generally going to be no to low premium. However, that is going to be determined by where you live throughout the country. Medicare Part D, which is known as your prescription drug coverage, once again, the price for those specific plans are going to be determined by where you live throughout the country. If you decide to stay on original Medicare and go with a Medicare supplement, the most popular being a Plan G, once again, that price is going to ultimately be determined by where you live throughout the country. Finally, if you need some ancillary plans to fill in the gaps that Medicare doesn't cover, to give you an example, that would be dental, vision, or hearing, because Medicare doesn't cover that, then the pricing for those plans are going to be determined by which carrier is in your area as well as where you live throughout the country. If you're wanting to take a deeper dive to find out exactly what your cost would be for your specific zip code, then reach out to us by calling the number on the screen. And as always, make sure to follow us to stay up to date on all things Medicare.